First aid for fractures, how to stabilize the bone and reduce pain until help arrives. Fractures are common injuries that can happen in everyday life, whether caused by a minor accident or a severe fall. Providing proper first aid can alleviate pain and prevent further damage until professional help arrives. What is a fracture? A fracture occurs when a bone is subjected to extreme pressure, causing it to break or crack. Fractures can be either closed, where the skin remains intact, open, where the bone breaks through the skin causing an external wound. Signs and symptoms of a fracture: severe pain in the injured area, swelling and redness around the site, visible deformity or unnatural angle of the bone, inability to move the affected limb, bleeding in the case of open fractures. Steps for first aid for fractures. 1. Assess the victim's condition. Ensure the person is breathing and their heart is beating properly. If the person is unconscious, call for help immediately and perform CPR if necessary. 2. Calm the victim. Keep the victim calm and reassured to reduce stress and anxiety. Avoid moving the injured limb unless absolutely necessary. 3. Stabilize the broken bone. Use a splint or any sturdy object, such as a straight stick or a piece of thick cardboard. Wrap the splint with soft bandages or cloth to secure it around the injured limb. Ensure the splint extends beyond the joints above and below the fracture site. 4. Avoid moving the broken bone. Do not attempt to realign the bone or push it back into place. Moving the bone may cause further damage. 5. Reduce pain and swelling. Apply cold compresses or an ice pack wrapped in a clean cloth to the injured area. This helps minimize swelling and relieve pain. 6. Protect open fractures. Cover open wounds with a sterile or clean cloth. Avoid applying direct pressure to exposed bone. When to seek immediate medical help. If there is severe bleeding, if the fracture is accompanied by shock symptoms, dizziness, pale skin, excessive sweating, if the affected limb feels cold or turns blue, indicating poor blood flow. In cases of suspected fractures to the spine or neck. Additional tips: keep the victim warm using a blanket. Do not give the person food or drinks in case surgery is needed. When in doubt, treat the injury as a fracture to prevent complications. By following these steps, you can provide effective and safe first aid until professional medical assistance arrives. Remember, quick and accurate first aid can make a significant difference in reducing harm and improving recovery chances.